I'm Dr. David Beaulieu, and I'm back with more news you can use. I want to talk to you today about vaccines causing more adverse reactions in children than any other drug. Been a new study, a groundbreaking study in Shanghai, China, that's provided us some really interesting information. More than 500,000 children are treated every year for adverse drug reactions in the United States outpatient clinics and emergency rooms. Wow. The study is particularly significant because the vast majority of reports came from physicians, pharmacists, and other healthcare providers. Less than 3% of the reports were from consumers. Drugs and vaccines are more dangerous for the very young just from the standpoint of what we call polypharmacy. Now, I talked about this earlier. We talked about a concept called lethal dose 1, where you can take your laboratory animals and you can give them enough of a toxic substance, let's say arsenic, to kill 1 in 100 animals. That's 1%. 1 animal out of 100. And then you find, let's take mercury. We'll give 100 animals mercury and we'll find the LD1, or the lethal dose that's going to kill 1 animal out of 100. And you put the two together and you give them to 100 animals. And how many animals should die? 2, 4, 8? No. 100 animals die. And that can happen with medicinals, drugs, just like it happens with toxic substances. Nobody knows, no one has done the research that can tell you how that aspirin is going to react along with your child's Ritalin. We don't know what the polypharmacy reactions are, especially in children with growing brains and growing livers and growing kidneys that are needed, livers and kidneys from a detoxification standpoint. But we know that when we give antibiotics to children, we create or contribute to the creation of a condition called leaky gut syndrome or gut dysbiosis. We know that that is an unhealthy gut situation, and we know that some of the leading neurologists today are calling the gut the second brain. Whenever you disturb the gut and put it into a dysbiotic state, you're going to affect behavior. Polypharmacy in anyone, but especially children, is a bad idea. And so what have we done? Our government has given vaccine manufacturers a free pass. In 1988, Congress passed a law shielding physicians and vaccine manufacturers from vaccine injury lawsuits. Good Lord. Prior to this law, most doctors were much more cautious about giving vaccines to children who'd had a prior adverse vaccine reaction for fear of being sued. Not anymore. I cannot tell you how many times in my practice, which goes between 40 and 60% pediatric, that parents have come into my office and said, you know, little Joey was fine until he got that antibiotic. And he's never been the same since. And we tell parents, oh, that's just a coincidence. When you sit back where I'm sitting and you hear parents tell you that story over and over and over, you begin to realize there is something to it, and that these parents are not crazy. They are paying attention, and they're giving us very, very important information. Now we're seeing thousands and thousands and thousands of children who are making emergency room visits. We need to greatly curtail the drugs that we're throwing at our children, because it isn't helping them. For the most part, it's harming them. What we need to do is make lifestyle changes at home, in our refrigerators, on our kitchen tables. and our children will respond appropriately, and we can start getting rid of some of these drugs. We need to be on low sugar, moderate to high fat diets. We need to get the crap out of the kitchen. That's your job.